For neuromuscular evaluation of the abdominal and lower thoracic area, as in spinal regions, a light lubricant cream is needed, not too oily to avoid slipping and sliding, just to protect the skin from drag. During intercostal evaluation, if any local areas of contraction or apparent dysfunction are noted, pressure is applied and the patient is asked, "Does that hurt?"
Yes.
Is it local or does it seem to spread at all or refer?
It's local.
And then the assessment continues through each intercostal space, involving finger strokes as well as thumb strokes from the sternum moving laterally. Is that painful?
Yes.
Is that local?
Yes.
Not spreading at all, not radiating at all?
No.
Okay. Anything that did radiate might be an active trigger point and require further assessment and treatment. After the intercostals have been combed through, the costal margin receives 1 or 2 thumb strokes. Is that reasonably tender?
That's painful.
Okay. Is it just local or does it seem to?
That's spread a little.
Where to? Which direction?
Circular.
Okay, so it's a radiating discomfort. Is that an area that you often get pain in, or is this something unfamiliar to you?
Unfamiliar.
Okay. If it's an active trigger point, or if it's a trigger point, would not be an active one. And these tissues would receive several strokes in which these attachments would be released. Then strokes are made from the xiphoid process on the sternum itself, evaluating for soft tissue dysfunction. When localized little contractures are noted, pressure is applied. Is that uncomfortable?
No.
Sometimes active trigger points are found on the rudimentary sternalis muscle. What about that one?
That one is
Local?
local.
Sure?
Yeah.
Not spreading.
Not spreading.
And so this general area would be evaluated, after which strokes are made from the xiphoid down the midline, looking for local dysfunction. Some pressure there. Is that painful at all?
No.
Evaluating for any soft tissue changes, using a weaving movement. Anything there?
Yes.
Again, same question. Is it local or does it seem to spread at all?
It's spreading.
Can you describe where it's spreading to or where else you're feeling it?
It's just all around.
Just radiating out from it. Is that a familiar discomfort?
No.
Okay. And then from the midline across the rectus abdominis muscle, evaluation can be by thumb stroke or by finger stroke. What about there?
Yes.
Again, local.
Radiating.
Again, the same question. Is it something you're familiar with as a pain?
No.
And is it just a spreading sensation?
Yes.
Okay. Unpleasant, though. All these local areas of dysfunction should be noted, and having combed through rectus abdominis with a series of strokes, a more sweeping stroke is made across the lateral aspect of the abdomen, either using thumb stroke, feeling something in there.
Yes.
What are you feeling?
It's uncomfortable.
Not pain as such.
No.
And if I change the angle of pressure, is that pain now?
No.
Still uncomfortable there. Okay, and so a series of strokes are made which comb through these lateral muscles all the way down to the pubic bone and the inguinal area. What about across here? How does this feel in terms of discomfort? Not particularly
fine.
uncomfortable.
That's painful. Yeah.
Again, the same question.
It's radiating. I'm not used to that.
Okay. And in this area, if you refer to the text describing Jones's positional release work, you'll note that this is an area which may be relating to psoas muscle. Does that seem to ease the pain at all?
It does slightly.
Now?
Yes.
So if it was a 10 when we started, what is it now?
It's a 5.
Okay. And if I relax the leg, if I turn it a little bit, now?
That's an 8.
Oh, didn't like that. If I take it there?
That's a 5.
Okay, and if I crowd it a little bit?
That's a 5.
Okay. By positioning, you can eventually get the score down and positionally release the tissues. Or simply note that there is pain there and it might be psoas related and work with it later. Following this, a series of strokes are made around the umbilicus, either using finger or thumb contacts, looking for local tensions which may relate to mesenteric restrictions. Descriptions of release of these is also included in this CD. Something there a little bit uncomfortable?
Yes.
Local?
No, it's radiating.
Again, an unfamiliar pain to you?
Yes.
Okay. Unfamiliar radiating pain refers to a latent trigger point, and it's important to note these. So a series of circular strokes are made around the umbilicus. Another one there?
Yes.
Again, the same question.
It's radiating and unfamiliar.
Okay. These are all worth noting. So the whole area then is combed and mapped. So the intercostals, the sternum, the costal margin, the rectal sheath, the lateral abdominal muscles, and the lower attachments, and the umbilicus area are all evaluated using NMT.